In a press release on Wednesday, the Ministry of Health in Trinidad and Tobago said that two travelers, one from the United States and another from Guyana, tested positive for COVID-19. When those COVID-19 samples were analyzed, it was shown that they were infected with a mutated form of COVID-19, the Delta variant. Responding to this report on Thursday, Minister of Health Dr. Frank Anthony said that the local authorities would investigate the matter.
I've seen that in the media and we'll investigate it. But as I've said before, we're working on the assumption, the clinical assumption, that we have the various variants here. The treatment and the things that you have to do would not change. Clinically, it doesn't change. But we know that Delta variant is more infectious, more transmissible, get people sicker and all those things. And that is why it is even more important, if we have the Delta variant here, that people get vaccinated.
While the minister said that the local authorities would assume variants are here, Guyana has not been able to definitively confirm the presence of variants since the country has not sent more COVID-19 samples to the Caribbean Public Health Agency, CARPHA, in Trinidad and Tobago for testing. Only 10 samples were ever sent for variant testing. These were sent at the beginning of this year and returned negative. When questioned about the testing for variants, it seemed as though he was suggesting that Guyana was no longer interested in testing for variants. But he clarified his position and spoke on why Guyana has not been sending samples for testing.
We will try to test, but if you're working on the assumption that you have those variants, then you just have to keep working and making sure that you protect people. And the best way to do that is to roll out this vaccination as quickly as possible.
Why have you been sending the samples?
It's what it is.
You're not sending?
Huh?
You're not sending the samples?
No, we are going to select and we're going to send. And but as I said, we're working on the assumption that we have all the variants.
Is there a problem with payment for the CARPHA for doing this?
No,
or is it
no,
that
no, I don't
there's
think
some other humbugs?
No, not that I'm aware of.
It is important to note that correspondences sent to the newsroom by CARPHA indicate that the agency has not stopped testing for variants, as was earlier reported. Previously, Minister Anthony explained that when variants emerge and become a variant of concern, it is because they have become more transmissible, that is, more easily spread, and in some cases, because they may evade the body's immune response to fight off infection. This Delta variant is a highly transmissible variant, though it is not the only variant, and it has resulted in surges of infections globally. Reporting for the newsroom, I am Esanela Pato.